Broccoli has earned a reputation as one of the healthiest foods on the planet, a powerhouse of vitamins, antioxidants, and cancer-fighting compounds. But here's the surprising truth almost no one talks about. For many seniors, this popular vegetable can quietly trigger serious health problems. That's right. The very food you've been told is good for everyone may actually worsen thyroid issues, intensify digestive flare-ups, interfere with medications, and even increase your risk of painful kidney stones. And the danger is subtle. You can eat broccoli for years without realizing it's the hidden culprit behind your fatigue, gas, heartburn, or inflammation. As we age, our bodies change, digestion slows, hormones shift, medications interact differently, and suddenly foods that were once harmless can become problematic. Broccoli is one of the biggest surprises on that list. In today's video, we'll reveal the 10 health conditions where broccoli can do more harm than good. Backed by science, not myths. You'll learn who should avoid it, who needs to be cautious, and how to safely enjoy broccoli if your body can tolerate it. If you or someone you love struggles with thyroid problems, kidney stones, IBS, gout, digestive diseases, or takes blood-thinning medications, this information may be critical for protecting your health. Stay with me until the end because we'll also share smart science-backed tips to make broccoli safer and easier for your body to handle so you can still enjoy its nutrients without the unpleasant side effects. Let's begin. Health problem number 1, hypothyroidism, underactive thyroid. For most people, broccoli is a nutrient-dense superfood. But for anyone with hypothyroidism, especially seniors, broccoli can quietly interfere with an already struggling thyroid. Broccoli belongs to the cruciferous vegetable family, which contains natural compounds called brogans. These compounds can reduce the thyroid's ability to absorb iodine, a mineral your thyroid must have to produce hormones. When iodine uptake drops, hormone production slows even further, worsening symptoms like fatigue, weight gain, cold intolerance, and mental fog. For a healthy thyroid, your body can easily handle small amounts of brogans. But for individuals with Hashimoto's, age-related thyroid slowing, or long-standing hypothyroidism, these compounds can add unnecessary stress to the gland. What makes this especially important for seniors is that thyroid efficiency naturally declines with age and medications like levothyroxine must be absorbed consistently. Excessive broccoli, especially raw, can interfere with both iodine use and medication effectiveness, creating unpredictable thyroid levels. This doesn't mean broccoli must be eliminated completely. Research shows that cooking broccoli significantly reduces its strogenic effects and eating it in moderation rather than daily helps prevent hormonal disruption. Seniors with hypothyroidism should avoid large portions, raw preparations, and frequent servings throughout the week. If you notice unusual fatigue, stubborn weight gain, a slower heartbeat, or worsening cold sensitivity despite taking thyroid medication, your broccoli intake may be playing a hidden role. Speaking with your doctor or dietitian about safe serving frequency can help you enjoy this vegetable without compromising thyroid health. Health problem number 2, kidney stones, especially calcium oxalate stones. If you've ever experienced a kidney stone, you know the pain is unforgettable. What many seniors don't realize is that broccoli can quietly increase your risk of stone formation. Not because it's unhealthy, but because it contains oxalates, natural plant compounds that bind with calcium inside the kidneys. For most people, oxalates are harmless. The body filters them out easily. But for anyone with a history of kidney stones, reduced kidney filtration, or dehydration issues, even healthy foods like broccoli can tip the balance in the wrong direction. Here's why it matters. When oxalate levels rise, they can combine with calcium to form sharp, hard crystals. Over time, these crystals grow into stones that block the urinary tract, triggering symptoms like severe lower back pain, burning urination, nausea, and even blood in the urine. Older adults are particularly vulnerable because kidney function naturally declines with age. Many take medications that affect mineral balance. Hydration tends to be lower in seniors. Diets rich in healthy vegetables may unknowingly increase oxalate load. Broccoli isn't the highest oxalate vegetable, but daily or large portion intake can become problematic when combined with other high oxalate foods like spinach, beets, nuts, and potatoes. If you're prone to stones, moderation is key. Research also shows that pairing broccoli with high-calcium foods during a meal can reduce oxalate absorption by binding it in the gut rather than in the kidneys. In short, broccoli can be part of a stone prevention diet, but not when eaten excessively or without considering total oxalate load. Health problem number 3, irritable bowel syndrome, IBS, and digestive sensitivities. For most people, broccoli is a digestive superstar, rich in fiber, antioxidants, and natural compounds that support gut health. But for older adults with IBS, small intestinal bacterial overgrowth, SIBO, or sensitive digestion, broccoli can quickly shift from helpful to disruptive. The main issue isn't the vegetable itself. It's what's inside it. Broccoli contains FODMAPs, a group of carbohydrates that are poorly absorbed in the small intestine. When these carbs reach the colon, gut bacteria ferment them rapidly, producing gas and drawing excess water into the intestines. For someone with IBS, this can trigger uncomfortable symptoms including bloating that worsens through the day, sharp abdominal cramping, excess gas, irregular bowel movements, a feeling of fullness even after small meals. The fiber in broccoli, especially insoluble fiber, can also act as a mechanical irritant for people with hypersensitive bowels. While healthy for most, it can intensify inflammation and digestive spasms in those with IBS or chronic gut conditions. Many seniors discover that even small amounts of broccoli cause issues, especially when it's eaten raw, paired with other high FODMAP foods consumed in large portions, eaten in the evening when digestion slows. But here's the good news. Broccoli doesn't have to be eliminated entirely for everyone with IBS. Some tolerate it well when cooked thoroughly. Steaming can reduce FODMAP content and soften fibers, making it gentler on the gut. Still, if broccoli consistently causes bloating or pain, it may be a sign your gut needs a break from it or that you need a smaller portion. Health problem number 4, iron deficiency anemia. Broccoli is often praised for its iron content, but for individuals struggling with iron deficiency anemia, it can quietly work against their efforts to rebuild healthy iron levels. The issue isn't the iron itself. It's broccoli's very high fiber content and its naturally occurring compounds that interfere with iron absorption. Broccoli contains insoluble fiber which moves quickly through the digestive tract and binds to minerals including iron before the body has a chance to absorb them efficiently. For healthy individuals, this isn't a major issue. But for seniors with chronically low iron or anyone prone to anemia, this reduced absorption can prevent iron stores from improving even with supplements. Additionally, broccoli contains polyphenol and oxalates which further inhibit the uptake of non-heme iron, the type found in plant foods. These compounds attach to iron molecules in the intestines, creating complexes the body cannot absorb. Over time, this can contribute to persistent fatigue, weakness, dizziness, cold hands and feet, and shortness of breath. All classic signs of anemia. A common mistake is assuming that eating more vegetables automatically leads to better nutrition. For anemic individuals, however, eating large servings of broccoli daily, steamed, roasted, or raw, can unintentionally lower iron bioavailability, making it harder for supplements or dietary iron to do their job. This doesn't mean broccoli must be eliminated entirely. Instead, the focus should be on timing and pairing. Broccoli should not be eaten with iron supplements or iron-rich meals because it competes with absorption. Vitamin C increases iron uptake, but the inhibiting fibers and oxalates in broccoli often overpower that benefit for people with anemia. The safest approach for iron-deficient individuals is to moderate broccoli intake and consume it at meals separate from iron-focused foods. Lean meats, lentils, eggs, and iron supplements should be taken without cruciferous vegetables nearby on the plate. If anemia persists despite a good diet and supplementation, reducing or temporarily removing broccoli from daily meals can significantly improve iron recovery, energy levels, and overall vitality. Health problem number 5, gout and high uric acid. Broccoli may seem like an unlikely trigger for gout, but for individuals with elevated uric acid levels, it can quietly worsen symptoms. While broccoli is not the highest purine vegetable, it still contains enough purines to be problematic for seniors who are already sensitive or prone to recurrent flare-ups. When purines break down in the body, they form uric acid. For most people, the kidneys efficiently remove excess uric acid. However, in older adults or anyone with reduced kidney function, uric acid may accumulate in the bloodstream. Once levels rise too high, uric acid begins crystallizing in the joints, most commonly in the big toe, ankles, knees, and fingers. These sharp needle-like crystals trigger intense inflammation and the classic painful gout flare. Broccoli becomes an issue when it is consumed frequently or in large portions, especially alongside other purine-rich foods like spinach, mushrooms, seafood, red meat, and organ meats. For some individuals, this combination is enough to tip the balance and raise uric acid above a safe threshold. Another factor is that high-fiber cruciferous vegetables can temporarily slow digestion, which may impair the body's ability to eliminate uric acid efficiently. Many seniors who believe they are eating clean are surprised to learn that overloading on broccoli, cauliflower, or Brussels sprouts may actually increase the frequency of their gout attacks. Symptoms such as sudden joint swelling, warmth, redness, or nighttime pain after eating broccoli may signal purine sensitivity. This doesn't mean you must eliminate broccoli completely. For most gout-prone individuals, moderation is key. Small servings, about half a cup cooked, are usually well tolerated, especially when paired with plenty of water and low purine foods like cucumbers, lettuce, berries, and whole grains. Those experiencing active gout flare-ups may benefit from avoiding broccoli temporarily until inflammation subsides. Managing gout is all about lowering the overall purine load. If broccoli is part of your daily routine, reducing the frequency may significantly help stabilize uric acid levels and protect your joints from painful attacks. Health problem number 6, acid reflux, GERD. Broccoli is widely praised as a digestive-friendly vegetable, but for many older adults dealing with acid reflux or GERD, it can unexpectedly make symptoms worse. The reason has less to do with acidity and more to do with broccoli's fiber density and gas-producing compounds. Broccoli contains raffinose and other fermentable fibers that create gas during digestion. In someone with reflux, this extra gas increases abdominal pressure, which can push stomach acid upward into the esophagus. That means more heartburn, more regurgitation, and more nighttime discomfort. Another issue is that high-fiber foods slow down stomach emptying. When food lingers in the stomach longer than normal, it increases the likelihood of acid escaping into the esophagus, especially when lying down. Many people notice that eating broccoli with dinner leads to overnight reflux or a burning sensation in the chest. Additionally, broccoli is known to stimulate gastric acid production in some individuals. While this is harmless for a healthy digestive system, it can be problematic for those whose esophageal lining is already irritated or inflamed. Even steaming, which usually makes vegetables easier to digest, does not always prevent these effects. For seniors managing GERD, portion size matters just as much as the food itself. Large servings of broccoli, especially when combined with other trigger foods like onions, tomato sauces, or fatty meals, can create a perfect storm for reflux flare-ups. Many people find that small, well-cooked portions paired with lean proteins are easier to tolerate. While raw broccoli or big dinner servings tend to provoke symptoms, if broccoli consistently triggers burning, pressure, burping, or sour taste in the throat, it may be worth limiting or temporarily avoiding it while focusing on gentler vegetables such as carrots, zucchini, or spinach. Health problem number 7, blood thinners, worsen, coadin, and similar medications. For individuals taking blood-thinning medications, broccoli can quietly interfere with the very treatment meant to protect their lives. The issue lies in broccoli's high vitamin K content, a nutrient essential for blood clotting. Under normal circumstances, vitamin K is healthy and beneficial. But for people on prescription anticoagulants, too much vitamin K can reduce the medication's effectiveness. Blood thinners like worsen work by limiting the body's ability to use vitamin K for clot formation. When someone suddenly increases their intake of broccoli or any vitamin K-rich food, the body receives mixed signals. This can lead to blood that becomes thicker than intended, increasing the risk of dangerous blood clots, stroke, or heart complications. The problem is not broccoli itself. It's inconsistency. Most seniors don't realize that even one extra cup of broccoli per day can throw off their medication's balance. A stable dose of worsen depends on predictable dietary vitamin K intake. Large or regular servings of broccoli force the medication to work harder, often requiring doctors to adjust the dosage. Common warning signs that vitamin K intake may be interfering with blood thinners include increased bruising, bleeding that takes longer to stop, sudden changes in INR readings, feeling faint or unusually fatigued. Unfortunately, many people never connect these symptoms to a simple shift in their vegetable choices. Does this mean people on blood thinners must avoid broccoli entirely? Not necessarily. The key is consistency and moderation. Small, steady amounts of broccoli controlled day by day can be safe as long as they don't vary wildly. But if your doctor has advised strict limits on vitamin K or if your INR has been unstable, then reducing broccoli intake may help restore medication effectiveness. Always speak with your health care provider before making dietary changes. But as a rule of thumb, anyone on anticoagulants should treat broccoli as a precision food, not a casual one. Health problem number 8. Ulcerative colitis and Crohn's disease, IBD conditions. For individuals living with inflammatory bowel diseases like Crohn's disease, or ulcerative colitis, broccoli can be far more irritating than helpful. Although this vegetable is rich in antioxidants and fiber, its tough insoluble fiber, dense cell structure, and high FODMAP content can intensify inflammation and trigger painful digestive flare-ups. People with IBD often have a digestive tract that is already inflamed, sensitive, and easily overwhelmed. When broccoli's fibrous stalks and fluids pass through the intestines, they can mechanically irritate the gut lining, leading to symptoms such as cramping, bloating, diarrhea, and sudden urgency. The same fiber that benefits healthy individuals can create abrasion-like irritation for those with active or sensitive IBD. Broccoli also contains raffinose, a complex carbohydrate that ferments rapidly in the colon. In people with inflammatory bowel disease, this fermentation produces excessive gas and pressure, aggravating existing inflammation. Clinical digestive studies show that high FODMAP vegetables, broccoli included, commonly increase symptom frequency in both Crohn's and ulcerative colitis patients. Another issue is that broccoli's nutrient density doesn't always compensate for its digestive demands. During flare-ups, the digestive system has reduced ability to absorb nutrients efficiently. Eating broccoli at this time may actually worsen malabsorption and trigger more inflammation rather than supporting recovery. This doesn't mean every person with IBD must avoid broccoli permanently. Many tolerate well-cooked, very soft broccoli in small portions during remission. However, when symptoms are active or if you notice that broccoli consistently causes discomfort, reducing or eliminating it can offer immediate relief. People with Crohn's or ulcerative colitis should limit raw or lightly cooked broccoli. Favor steaming until very soft if consumed. Avoid stems which are tougher to digest. Monitor symptoms after each serving. Consult a gastroenterologist for individualized tolerance testing. In the delicate world of IBD, even a healthy vegetable can become a trigger. Recognizing broccoli as a potential irritant helps individuals protect their gut, reduce flare-ups, and maintain digestive stability. Health problem number 9, diverticulitis. For individuals living with diverticulitis, broccoli can trigger far more discomfort than most people realize. While broccoli is celebrated for its fiber and nutrients, that same fiber can become problematic for those with inflamed or irritated intestinal pouches known as diverticula. During a diverticulitis flare-up, the digestive tract becomes highly sensitive. High fiber, rough, or gas-producing vegetables like broccoli can add friction inside the colon, worsening pain, bloating, and cramping. Broccoli contains insoluble fiber and fermentable carbohydrates, both of which can increase intestinal pressure. This added pressure may aggravate inflammation and make flare-ups more frequent or more intense. Additionally, broccoli's ability to produce gas during digestion can be especially uncomfortable for people with diverticulitis. Excessive gas expands the colon, puts stress on weakened intestinal walls, and can trigger sharp abdominal discomfort, something many older adults with diverticulitis experience after eating cruciferous vegetables. That doesn't mean broccoli must be eliminated forever. Many people tolerate it well between flare-ups, especially when it's cooked thoroughly until very soft. Portion sizes are kept small, and it's eaten alongside gentler foods that don't stimulate gas formation. But during active inflammation, gastroenterologists strongly recommend avoiding broccoli to give the intestines time to rest and heal. Listening to your body's response is crucial. If broccoli consistently causes pressure, pain, or bloating, reducing or pausing intake can dramatically improve digestive comfort and reduce flare-up frequency. Health problem number 10, gallbladder issues. If you have gallbladder problems, such as gallstones, bee sludge, or a history of gallbladder attacks, broccoli may not be as harmless as it seems. While this vegetable is nutrient-dense, its high fiber content and tendency to produce gas can place extra strain on an already sensitive gallbladder and digestive system. The gallbladder's main job is to release bile to help break down dietary fats. When the organ is inflamed or not functioning properly, even normal digestion can feel difficult. Broccoli, especially when eaten in larger amounts or undercooked, can increase gas production, intestinal pressure, and digestive workload. This added pressure may worsen symptoms such as right-side abdominal pain, bloating after meals, nausea, belching, and discomfort that radiates to the back or shoulder. Additionally, broccoli belongs to the cruciferous vegetable family, which contains compounds that can temporarily slow digestion and cause fermentation in the gut. For someone with gallbladder sensitivity, this can trigger discomfort that mimics a mild gallbladder flare. This doesn't mean all gallbladder patients must permanently avoid broccoli. Many people tolerate it well when it's cooked thoroughly until soft, eaten in small servings, and paired with low-fat meals that are easier on the gallbladder. However, during active inflammation or gallbladder attacks, most doctors advise avoiding cruciferous vegetables to reduce digestive stress. If you notice that broccoli consistently leads to upper abdominal pressure, gas, or discomfort after meals, consider reducing your portion or temporarily removing it from your diet. A gentler, low-fiber, low-fat approach can give your gallbladder the rest it needs to function more comfortably. Final conclusion: broccoli is often praised as one of the healthiest vegetables on the planet, and for most people, it truly is. But as we've explored, healthy doesn't always mean healthy for everyone. For seniors or anyone managing chronic conditions, broccoli's high fiber, potent plant compounds, and natural growgens can sometimes work against the body instead of supporting it. If you struggle with thyroid imbalance, kidney stones, IBS, GERD, gout, anemia, Crohn's flare-ups, diverticulitis, or gallbladder issues, understanding how broccoli affects your system can make a dramatic difference in your daily comfort and long-term health. The key is not fear, but awareness. Broccoli doesn't need to disappear from your plate forever. For many people, small adjustments like reducing portion size, choosing cooked instead of raw, pairing it with vitamin C, or rotating it with gentler vegetables can help you enjoy its benefits without triggering symptoms. Your body is always giving you signals. Listening to those signals is one of the most powerful forms of self-care. At Ageless Vitality, we believe that healthy aging starts with informed choices, not guesswork. By understanding how foods interact with your unique health needs, you can take back control of your energy, digestion, and overall well-being, one meal at a time. If this breakdown helped you, tap the like button to support the channel, and share this video with someone who may be unknowingly struggling with broccoli-related symptoms. And don't forget to subscribe so you never miss our next science-backed, senior-focused health guide. Your health is your greatest asset, and we're here to help you protect it every step of the way.